So the title is Rethinking Autism Assessment, and the photo is a takeoff of a movie poster from Love in the Time of Cholera by Gabriel Garcia Marquez. Of course, many of us are feeling like we're living in another Gabriel Garcia Cortez novel, 100 Years of Solitude. So I'm just delighted to have the social contact and the chance to spend the day with all of you today. And again, to participate in this wonderful event. So Alicia, being the ever thoughtful and forward-thinking person that she is, brought together an interdisciplinary group of clinicians and researchers and a parent leader to talk about the assessment challenges during COVID, which Dr. Feliciano touched on quite thoughtfully from the Spark research group as well. So our discussion group met over the course of a year, and I am really honored and delighted to present some of these thoughts on behalf of the group. So I love this photo. So this is my friend and colleague, Jessica Bryan, who I haven't seen in person for a couple years because of the pandemic. It really reminds me of what drew most of us to our professional work, the joy of seeing children and youth and how gratifying it is to support them and their families. So our discussion group started with the challenge of how the pandemic has disrupted our usual clinical practice and the technical adaptations that we implemented, including virtual care. So a number of the things that were touched on in the Spark research. But we quickly realized that we were really looking through quite a narrow lens, and it was mainly our own lens. And we started talking more and more about what families were experiencing and the barriers and stresses that they were facing. And although unquestionably there were stresses that were specific to the pandemic, like disrupted services, the children being out of school, the social isolation that families were experiencing, we also realized that COVID was bringing to the surface some serious issues that had really been there all along. And in some respects, the chasm between system capacity and needs was widening under the pressure of COVID, in part because there were already kind of cracks or faults in that system. Like in the foundation of our care, there were some faults just waiting to expand sort of under the pressure of the circumstances of the pandemic. So in some respects, our discussion expanded on issues that families and professionals have been grappling with for a number of years. And these were highlighted in two companion commentaries that were published in early 2020, just as the pandemic was starting. The first was by Steve Canay and Summer Bishop, which emphasized the importance of high quality assessments by specialized teams. And the second, a follow-up by Zach Warren and I, really agreeing with Steve and Summer's important points, but also noting that autism rates were rising a lot faster than our ability to train the highly specialized professionals that populated these teams, which contributed to long wait times. And the reality was that there was variable access to such teams, especially outside of large urban centers, which contribute to disparities in care. I mean, the bottom line is we need to find a way to maintain the quality and integrity of the autism diagnostic system while at the same time improving overall capacity and accessibility. In this original commentary, we also cited evidence which included major contributions from Zach and his colleagues at Vanderbilt, as well as others that were ultimately involved in our Autism Science Foundation discussion group, including Amy Weatherby, Wendy Stone, Kristen Soule, about the feasibility of training and mentoring community professionals. I really want to emphasize as well that Summer Bishop was a part of the leadership of our Autism Science Foundation discussion group, and Steve Canay has made major contributions to the effort to adapt autism assessments during the pandemic. So this is very much a collaborative effort to make autism diagnosis family-centered and more accessible, and to give some serious thought to the ways that we can improve our system of care. So clearly, we need a system that values high levels of clinical expertise, a holistic approach that involves the contribution of multiple disciplines, and the capacity to meet our commitment to provide timely access to diagnostic assessment, which, as we know, is generally a gateway to supports and services. It's also important to recognize that there are risks to a one-size-fits-all system, that setting strict requirements for how many disciplines or who needs to be involved and the particular measures that need to be used, especially if those requirements don't take account of the characteristics of the child or the complexity of their clinical presentation, that a rigid one-size-fits-all approach really creates bottlenecks in the system, and during extraordinary circumstances like the pandemic can make it extremely difficult to adapt and pivot to new approaches. And it's important to acknowledge that when we're thinking about assessment quality, we need to take account of a lot of essential elements, including accuracy, standardization, and comprehensiveness, but also access, adaptability, and the degree to which our care is family-centered. So responding to the questions that parents have, their need for accurate information, as well as, of course, the provision of hope. So consistent with the principles of the latest practice statements from the American Academy of Pediatrics and the Canadian Pediatric Society, some communities are establishing multiple interconnected clinical pathways to autism assessment and diagnosis, with some children whose behavioral symptoms are more evident being seen in the community. So for example, there are a number of training models that have empowered community pediatricians to conduct diagnostic assessments in their own office. So history taking, their own versions of interactive assessments with ongoing mentorship that includes case review with an autism specialist. And in a sense, the pediatricians participating as part of a virtual team. So for instance, they might be interacting with community professionals, reviewing and integrating assessments by their colleagues, including speech and language pathologists. And this certainly can include a degree of standardization, for instance, in the administration of an office-based interactive assessment. There's also the option of shifting to a more comprehensive assessment by a specialty team when there ends up being more ambiguity or complexity than anticipated. And what we're ultimately trying to accomplish is adding to a skilled workforce of professionals that can make a quality autism diagnosis and building greater capacity and flexibility into the system. Another important theme that came up in our Autism Science Foundation discussion group were disparities in care experienced by African Americans, Hispanic families, and other non-Caucasian groups, as well as families disadvantaged by socioeconomic stressors. A major concern was that disruptions in the care system during COVID would kind of exacerbate systemic barriers that were already there, as well as disparities to access and assessment, and potentially widening the age of diagnosis. And the whole question of further delays in diagnosis that came up in the earlier talk. I don't know that we have data yet, but certainly anecdotally, it took us a while to kind of pivot to a new system of care. And as Dr. Feliciano alluded to, there are some children that may be very difficult to provide a confident assessment sort of using these new virtual methods. There are certainly some potential strengths of virtual assessment, using platforms like we're using today. It might make the diagnosis more accessible to families who prior to the pandemic would have had difficulty traveling a long distance to a specialized center. It also provides a unique opportunity to see the child in their own home environment and with their family and other relatives and, in a sense, a much more real life assessment of what they're like. On the other hand, this novel approach also has the potential of creating new barriers and disparities. For parents who didn't feel comfortable letting unfamiliar people into their home, nor acting as the assessor in some of these new parent-mediated approaches. And of course, having reliable high-speed internet, which in Canada, and I suspect in the US as well, is like a huge challenge in many rural and remote areas, and also in many urban areas, and certainly a major issue for the Canadian Indigenous communities. And of course, this creates a new challenge of digital health inequities. So the gains that we make in terms of accessibility potentially outweighed by creating further disparities. So families and professionals were all facing the challenge of adapting to the unique stresses and disruptions related to COVID, and really superimposed on an already strained service system that was not keeping up and was also fragmented with limited collaboration across sectors. I personally would also argue that there's been untapped capacity among community professionals to contribute to the diagnostic process. I believe that we can create a more integrated system that allows assessments to be better tailored to the needs of the child and family, and ultimately promotes holistic care closer to home, including continuity of healthcare. It's not easy to make all these changes in a short period of time and to confirm that we're on the right path. And, the reality is we've needed to adapt and pivot really rapidly with these dramatic and sudden changes in the care landscape. And we've needed to evaluate in real time the effectiveness of new practices. And as Greg alluded to, I'm a clinician, but also a researcher. So I'm hesitant to sort of put aside all the things that I've learned about research methodology. But I have to say that we have to consider new approaches, not only to our clinical care, but also to evaluation. And I feel like I've had a crash course over the past year or so in quality improvement approaches. So that is iterative assessment of small tests of change, which continuously shape a particular care process. And the truth is this quality improvement framework offers some advantage over conventional research designs. For example, learning health systems integrate quality improvement science with clinical practice as a collaborative method for addressing complex clinical challenges, including diagnostic practices. And it's very much a partnership model that's ready-made to involve people with lived experience, including autistic adults and parents. So promising practices in this regard include the Extension for Community Health Outcomes, or ECHO Autism model, which many of you may be familiar with, which blends case-based telemonitoring and guided practice to build community capacity for autism diagnosis. So it's built on the QI framework of collaboration and small tests of change. Kind of starts with the community conversation, some initial training, mentoring, and then ultimately shaping skill level, case review, and building towards quality assessments in multiple streams. And this framework, in particular ECHO Autism, has been led by Kristen Soul with collaborators Alicia Curran as well as Micah Mazurek, and has really been an exemplary model of community partnership, allowing for rapid evaluation of novel practices and rapid scaling and capacity building. And there are many other QI programs currently underway to evaluate sort of new novel models of virtual care. So what does the future hold? So with respect to diagnostic assessment, we have our work cut out for us. We need to find the right balance between comprehensiveness, adaptability, and accessibility. We need to foster partnerships between specialty and community professionals to create a continuum of assessment options tailored to the complexity of the child's clinical presentation and family's priorities, and together build community capacity. We also may need to be more open to novel assessment practices, which were a stopgap for the pandemic, but we may need to integrate these into our longer-term system of care. Telehealth, as well as continuing to support community models, including pediatrician training, that ultimately could increase accessibility and build greater adaptability into the system in response to a changing environment and also potential disruptions in the future. And we must actively partner with families and autistic people to advocate for system change and to ensure that the way we evaluate clinical practices are co-developed and through a lived experience lens. And if that wasn't enough, we need to dig deep and informed by the lessons taken from working with younger children and build a system that provides timely, equitable, and patient-centered diagnostic assessment for autistic adults who also need our attention, really another major gap that we need to address as a clinical community. So again, I'm so grateful for the opportunity to participate in this day of learning. I want to acknowledge my colleagues in the Autism Science Foundation discussion group, including Summer, Wendy, Lisa Ibanez, and Alicia, who did the heavy lifting in terms of formulating these ideas that I shared today. I also want to acknowledge my colleagues, Jessica Bryan and Angie Ip, who were instrumental in developing the Canadian Pediatric Society practice guidelines, which have also kind of shaped my thinking around these issues. My colleagues in infant sibling research, including in our own group and through the Baby SIBS Consortium, my colleagues at the Glenrose, who've been really instrumental in building capacity in our own community, the Stollery Children's Hospital Foundation, who support my chair, and other research funders, and of course, many wonderful children, youth, autistic adults, and their families who've really shaped our ideas and our practice and remain essential partners in this process. So again, thank you for the opportunity and looking forward to your questions. Whoops, sorry, I will unshare. How long does it take a developmental pediatrician to learn how to use Zoom? Here we go.
Well, I was just going to say there may be many downsides of living in Alberta, Canada in the middle of the winter, but one of the upsides is that Lonnie might be your child's pediatrician, or Lonnie is part of the team that helps make decisions about how children in Canada are assessed and helped. So it was a real pleasure and a total honor to have you as part of this day of learning. And I'm so thrilled we got to touch on some of the issues that have plagued clinicians, not just families, in them trying to help families during the pandemic. So what do you think about a hybrid model? So we talked about the benefits of in-person. We talked about the benefits of working remotely or assessing remotely. What's the future of a hybrid model for assessments?
I think you're right on, Alicia. I think it's a hybrid model that I think will take us forward. In a sense, it's not only about novelty, but it's about expanding our toolbox so that we've got greater flexibility to offer assessment approaches that make sense for the child, the family, and ultimately for the adult. And it just gives us a bit more flexibility when we're kind of cut off from some of our usual clinical practices. We've got other approaches that we're familiar and experienced with, and that have been socialized in the broader community that we can turn to. And I think sort of having that a greater number of options. And I think recognizing the diversity in the autism community and the diversity of needs, and frankly, the kind of assessment that I'm going to do at the Glenrose as a developmental pediatrician can and should look different than what a community colleague is doing in their offices. And, you know, I'm cognizant that I went overtime. I'm a developmental pediatrician. I can't stick to the clock. My community pediatricians, they work like clockwork. And I may question sometimes that maybe they should have spent some more time. And part of that ongoing training and mentorship is about that. But it's amazing sort of how much that they can improve capacity and see kids in the time that they need. And if we can all work together and ensure that we find the ability to maintain quality and comprehensiveness of information, but also make sure we're seeing lots more people that need to be seen, I think there's a way to move forward. And I have to say, in my other clinical roles, I've seen virtual care really revolutionize pediatrics. I live, in kind of towards northern Alberta. So there's a lot of people that used to fly in or travel hundreds of miles in order to access our children's hospital. And the ability to offer virtual care and save people hours on the road and disrupting their family and children's routines, I think will kind of open new access. It's not for everyone or for every situation, but I think I hope that it will go on sort of beyond the pandemic.
We have time for one more question, and there's a couple that have come in that fill in the same theme, which is people who are either community healthcare workers or social workers or people that aren't normally trained because they're trained in other things to evaluate or assess children for autism. In other countries other than North America, this is a real issue and they actually don't have a lot of expert diagnosticians. So how do you see those individuals being trained up or being prepared to not provide formal evaluations in the traditional sense, but to help provide some sort of assessment so that they are, in some way qualified to give families answers in areas of the world or even situations where access to a specialist is not available?
Yeah, so it's a great question, and it is important to think globally and make sure that these models sort of apply sort of across situations. I think there has to be a fit in terms of expertise and what we're asking people to do, and just sort of recognize the limits to scope of practice. At the same time, there's lots that we can do. I mean, we've learned so much because of this community in terms of how to assess early signs, how to ask parents questions about their children's development, and I think increasingly how to support adults talking about their lived experience as well. And I think it takes a village, and that specialists probably need to divide their time more around sort of providing training and mentorship, because I think it really leverages sort of what we can provide for individual families, for larger communities of professionals, and ultimately for children and families. And I think we just have to be thoughtful about what each of those professionals is doing. I mean, you're right that there's a scope of practice issue around actually providing a diagnosis, and yet families have a lot of information needs about what they should be looking for, what information they can access, what they can be starting with in terms of creating a learning environment for their kids, sort of as they're navigating that diagnostic process. And it's a lot of excellent information out there. And I think we just need to work collaboratively to really make sure that we're all kind of achieving our scope of practice. And I think that scope does include training and mentorship and working collaboratively with that larger community.